Good afternoon. Welcome to day 244 at the County EMA office where Chairman Mark Kern and Sam Behrman are here again today. It seems like every day. Sam, you have the numbers.
I do. While we have some better numbers today, we are nowhere near where we still need to be. So please don't let these good numbers today lull you. We are still fighting for where we need to be. As of today, 129,978 St. Clair County residents have been tested, which is an increase of 1,738 from yesterday. We are at 11,031 positive test results, which is an increase of 150 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. Today, our daily county positivity rate is 8.6%. And before we go any further with any of our numbers, I do want to point out for someone, yesterday we processed 760 results, 205 of which were positive. So that gave us a percentage rate of 27% positivity rate. Today, we had 150 positives and we processed 1,738 tests. So as you can see, today, while we still had 150 positives, we had quite a few more, almost double the amount of tests that we processed yesterday from today. So as of today, we are at 118,947 negative test results and announcing no new deaths. So we are still at 230. For those who have completed the IDPH required 10-day isolation period, we are at 9,270. For state totals, 8,765,100 have been tested, with 536,542 positive test results, which is an increase of 12,702 from yesterday. And for deaths, the state is reporting 10,477, which is an increase of 43 from yesterday. For hospitalization numbers in St. Clair County, currently we have 81 individuals that are admitted due to COVID-related reasons, and 11 of them are on ventilators. Regionally, we have 177 individuals that are admitted due to COVID-related reasons, and 23 of them are on ventilators. For our congregate living facilities and long-term care facilities that are in outbreak status, currently or previously, these are cumulative numbers, and we will only announce any facilities that have had any changes. Cedar Ridge of Lebanon has 84 cases and 16 deaths, which is an increase of 4 cases for that facility. The Esquilin Dammert Center at the Shrine has 64 cases and 10 deaths, which is an increase of 2 cases of that facility. And St. Paul's Home in Belleville has 62 cases and 15 deaths, and that is an increase of 2 cases for that facility. We do still have testing coming up this weekend, for anyone that's interested, and we urge everyone to go get tested. Saturday and Sunday, both November 14th and November 15th at Belleville West High School from 8 a.m. to 4 p.m. each day. And that is at 4063 Frank Scott Parkway West, and that specific information will be both on the EMA Facebook page as well as the Health Department page. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we'll go into the zip code report. These are the COVID positive changes in these particular St. Clair County zip codes. We'll start today with 62201, up 1 to 325. 62203, up 5 to 322. 62205, up 1 to 278. 62206, up 9 to 586. 62207, up 6 to 320. 62208, up 3 to 639. 62220, up 9 to 803. 62221, up 7 to 1,016. 62223, up 12 to 702. 62225, up 1 to 54. 62226, up 18 to 1,191. 62232 is up 1 to 294. 62239 is up 5 to 160. 62240, up 1 to 58. 62243, up 2 to 203. 62254, up 8 to 357. 62258, up 4 to 338. 62260, up 8 to 256. 62260, up 8 to 256. 62269, up 22 to 977. 62282 is up 1 to 25, and 62285 up 1 to 212. Daily county positivity today, 8.6%. We tested 1,738 people, 150 of those were positive. That's how we come up with the 8.6 number. That brings our 7-day rolling average to 14.8%. The state has our regional positivity today up again to 13.9%. They derive that from Bond County at 15.5%, Clinton County 5.4%, Madison County 15.6%, Monroe 8.5% today, Randolph 11.4%, St. Clair's at 8.2%, and Washington County at 11.3%. The numbers are going up. We heard from the governor and the state earlier, and I'll talk to Herb a little about this, but Illinois Department of Public Health is recommending that if people don't have to go out, that they don't, that they, of course, the essentials are there, employment, those type of things, but in light of recommendations from the Illinois Department of Public Health, we'll be closing the St. Clair County Courthouse starting on Monday to the general public. Employees will still be there, appointments will still be able to be made, but as far as the day-to-day in and out traffic, we'll be closing the courthouse to that on Monday. So we're going to go back to basically where we were in April, which is really where we are with the numbers right now. We've got to get these numbers down. We've got to come up with a way to try to isolate the virus and keep it from spreading. And right now, we're in major public spread. The fact that we have these high numbers every day, 150 new positives today in the county, and it's only growing. We're very concerned with the holiday coming on, Thanksgiving, that this can just continue to grow. Let's get tested. Let's isolate ourselves. Let's try to get this virus under control. It's a terrible thing. It's real. It's out there. If you wear your mask, if you wash your hands, and you watch your social distance, and you don't go out unless you really need to, we can get this thing under control and keep everyone safe. The vaccination is on its way. It will be approved, we're told, by the end of this month. It'll take a while to get it out into the general public, but there is light at the end of the tunnel. We just have to get there. We've really got to get through winter is going to be the real test of our mettle here in St. Clair County. And if we all work together like we have, and we have been, we got those numbers down in May and June, and if we remember how low they were in July and August and September, we can get there again. We've just got to isolate this bug, get it under control again, and then keep it under control until we can get the vaccination to everyone. It's going to be a significant effort. St. Clair County is a big county, 260,000 plus people that are going to have to be vaccinated twice, from what we're being told. So it is going to be a Herculean task, but we've got great people at the health department, great people at EMA, and of course, State of Illinois Department of Public Health, the governor's office. Everyone's committed to try to end this thing so we can get our lives back to normal. Not a new normal. I think we go back to where we were before, since they discovered this vaccine and since they think it's 90% effective. I think that really we can, at least all signs are pointing to the fact that by July 4th, hopefully, and don't hold me to that, but it looks certainly like we should be back to where we need to be and going to baseball games again and watching the Cardinals win the World Series.
It'd be great, and I just want to say I applaud you for making the decision on the courthouse because, we're sitting here telling all of our Team St. Clair members that we've got to get this under control. So I think as Team St. Clair has done, leading by example. So hopefully that will catch on, because as Dr. Ezike said today, you have to limit those type of gatherings. And, as I reported the other day, we just came out of the Halloween. We had people sending us Halloween pictures and parties going on. Then we had the election day. People were out doing election. Tomorrow is actually at the end of our 14 days of that. But now we're faced with Thanksgiving coming on, so we've got to be prepared for that. And I think that's why Dr. Ezike spelled it out today on the call, that basically we have to be better prepared. We have to put the brakes on. Otherwise, these numbers are going to be through the roofs, and we're going to be like some of the states that we border, 50% positivity rate. And then once it gets higher, it's going to take longer to get it back down. So I think that, we did it before, as you said, and I think Team St. Clair, yes, and there are still those people out there that continue to, or the doubting Thomases, the naysayers, but we got to get by. We got to get beyond that. It's here. The numbers said. I got another call from one of the other hospitals today. We had people on the page again last night saying, I've got so-and-so that works at a hospital and they're not overloaded. Well, we're hearing every day those hospital numbers, and it doesn't show what some of the people are trying to post on there. Don't believe all of that. We've got the numbers. We've talked to the CEO, the presidents of the hospitals. We talk with the health department. We need to get those hospitalizations under control, and we can only do that by stopping the spread of this or slowing it down. As the chairman said, we get the vaccine here. That becomes another monumental task that we'll do. But if we can do this, we can do the vaccinations.
23 people on ventilators in the region. That's a big number, and when you're put on a ventilator, you've got serious issues. So.
Yeah, and so and we've heard from the physicians that we've had on here. This has been a learning stage from them since day one. They've changed their course of treatment from the beginning because it was a new virus. They didn't know a lot about it. They've been learning over the last 8 or 9 months. So, they're still learning. We're still learning. We're learning more and more about numbers every day.
And so back to the courthouse just for a second before we
Yes.
close. So essential services still will be offered. Employees that can work from home are going to work from home. Others will still be reporting to the courthouse. So you'll still be able to get, if you have something that you really need, it'll still come from the courthouse. Judge Gleason has made his announcement with the courts in a similar fashion to what we're doing. So I think we just all move together, and hopefully this is for the short term, but certainly it's a necessary thing to do to get us through this pandemic and get us through this latest spike. Let's hope this is the last return of the coronavirus in big ways.
Well, and I just want to mention also, because we have followers on the briefings from the whole region, and there was an article that came out today in Monroe County where they were actually pleading with everybody to, let's get our foot on the brake on this thing now, because they're actually seeing it down there. And so our region, as you can see, positivity 13.9. We got to get that way back down. 6.5 is a long way down there. So let's, as the chairman said, we can get it done. We did it before. And everybody working together, we can do it. Team St. Clair, keep spreading the word. We're seeing more and more people joining in, leaving their comments. We try to answer as many of them as we can, but we have a lot of chores we have to get done around here. But if you got a question, we'll try to get it answered for you. If not, our Sundays are our question days and answers. We try to answer all of them then. But we're going to be back here momentarily with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back tomorrow for day 245. Everybody have a good evening.
I was born and raised in East St. Louis, St. Clair County, City of Champion. We band together like family on picket where the Mary Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross the finish line.